committee members. The last one we have, I'll just make some preliminary comments and then see what we do. But on the Medicaid expansion, I do have concerns with the comments that have been raised in regard to this being viewed as less expensive and something different than what we have today when it was put on the ballot. And I didn't support expansion when there were efforts to try to pursue that through the legislature. It's been a while, and I think, again, the outcome is different. I want to read, this was a comment on our DOGE portal. It's not very long, but I'll just read it. This person said, I recently watched the most recent DOGE committee meeting. I'm a small Idaho employer. We offer health insurance. I'm deeply concerned. Health and welfare has lots of people on Medicaid that don't belong on Medicaid. They are able-bodied and working Idahoans exploiting the system. This is the expansion population. I have 11 employees that have requested a reduction in hours so they can keep Medicaid. They want to work 22, 28, 29 hours a week. They don't want to work beyond that because they will lose Medicaid. I try to explain that we have a really good health insurance policy and that if they would work 40 hours a week, they could afford the meager premium, $60 every other week. But they refuse, citing Medicaid is better. Committee, this is Idahoans on the government dole. This needs to stop. Please eliminate Medicaid expansion. It's training and teaching Idahoans how to be poor and live like they are our liberal neighbors. I may have chosen different language, but that certainly creates some frustration on my part that we have employers with health insurance benefits that are provided, and we have people not taking it so they can remain on Medicaid. I think repeal should be explored. And I guess my thought is kind of in line with some of our other motions. It's a complicated issue. And there are lots of moving parts related to, former indigency program and things to it. I would, I think, support some type of motion myself that would move that the germane committees consider repeal and hold hearings on this issue. I think it's a big enough issue that the germane committees, they need to explore whatever we do, but because of the complexity of the issue, I think that's my comments and my leaning, but I'll open it to